Hello, I'm Rhonda Morton and I'm delighted to share highlights from our new study on sustainable leadership in Australian healthcare, published in the Journal of Healthcare Leadership. We define sustainable leadership as the capacity to lead effectively over time, balancing today's operational imperatives with long-term system improvement, staff wellbeing and leaders' own resilience. It is leadership that nurtures innovation, builds inclusive leadership cultures, and leaves the system stronger for next generation. Why does leadership matter right now? Because every element of healthcare's quintuple aim is impacted by the way we lead. Yet in our national survey of 276 healthcare leaders, around 3 out of 5 rated the overall sustainability of leadership at 5 or below on a 10-point scale, and nearly half felt that support for leadership is low. We found that most leaders learn on the run. 71% rely on informal on-the-job coaching, while fewer than 1 in 4 have completed formal certificates or postgraduate study. Leaders value mentoring. Almost 90% find it helpful, but access to high-quality, structured programs and protected time was insufficient. People described formidable challenges. Managing poor performance topped the difficulty list, followed closely by shaping organisational culture, recruiting staff, change management and workforce wellbeing. Outdated hierarchical leadership models and a focus on short-term financial targets often stifle innovation and collaboration. Time pressure is relentless, and 1 in 4 participants place their personal wellbeing at 5 or below on a 10-point scale. The pressures are not felt equally. Male leaders reported higher support and wellbeing than their female colleagues, and career progression was particularly restricted for non-clinical staff and minority groups. Despite a somewhat sobering picture, our respondents were clear about the path forward. 90% believe that investing in leadership is critical for culture, engagement, trust and collaboration, and 88% link it strongly to safety, quality and efficiency. They called for evidence-based, inclusive leadership development pathways, mentoring and peer networks, leadership quality measures that value culture as much as cost, and above all, protected time to think strategically and to learn. We invite you to explore the full paper. You'll find data and practical ideas to lift leadership capability, reduce burnout, and build future-ready health services.